Hello coders, welcome to Fast Coder 21. Today we are going to learn why SOAP format is important for medical coders. So in order to code properly as a coder, we need to have the documentation which contains the SOAP format. In this session, we are going to learn what are included in SOAP format and what is the use of SOAP format, what are the components of SOAP format. Coders, if you are visiting for the first time, please click on subscribe button to receive future updates. In order to know very well, please watch this video until the end to acquire knowledge of SOAP. So what is SOAP? Usually, SOAP is the acronym for Subjective, Objective, Assessment and Plan. So SOAP is a process used by clinicians to identify and assess a patient's health status and the subsequent treatments or course of therapy to improve patient's health status. So basically, SOAP format is mostly used by physicians in order to identify the patient's health status and subsequent treatment or course of therapy to improve patient's health status. So after checking the health status, physician will use different methodologies including treatment in order to improve the patient's health status. Usually, we will see SOAP formats in CDI. Usually, we will call it as clinical documentation improvement, as well as in inpatient visits, as well as in SCC coding process. So, what is the use of SOAP? So, in order to write patients encounter in a structured way, physicians use SOAP format. So, as a coder, in order to code properly, physician needs to use SOAP format to include all the information related to the patient. So now we are going to learn four constituents of SOAP, which is first one is subjective. So subjective is the first heading of the SOAP note. Documentation under this heading comes from the subjective experiences, personal views or feelings of a patient or someone close to them. So basically this subjective section contains views or feelings of a patient which will be dictated by or informed by patient or someone else close to the patient. So what are included in subjective? First one, subjective contain chief complaint. Usually we will call it as CC. So the chief complaint or presenting problem is reported by the patient. This can be a symptom, condition, previous diagnosis or another short-term statement that describes why the patient is presenting today. So basically chief complaint is the problem or condition which is experienced by the patient. So common examples include chest pain, decreased appetite, shortness of breath. So chest pain, decreased appetite, shortness of breath, all of these all symptoms of other conditions. So after the assessment plan, physician will diagnose the what is the reason for all these symptoms and he will finalize the diagnosis for current admission or encounter. So a patient may have multiple chief complaints and their first complaint may not be the most significant one. So hence physicians should encourage patients to state all of their problems while paying attention to detail to discover the most compelling problem. Identifying the main problem must occur to perform effective and efficient diagnosis. So when a patient comes to the hospital or clinic, so the patient's current complaint is not a significant one. So in order to find the significant finding or symptoms or in order to provide the appropriate treatment, physician needs to inform the patient to provide all the symptoms present in the current admission. Also subjective contains history of present illness. Usually we'll call it as HPI. So the HPI begins with a simple one-line opening statement including the patient's age, sex and reason for the visit. We will see one example here. 47-year-old female presenting with abdominal pain. Here patient's age is 47 years, sex is female and reason for the visit is abdominal pain. So in HPA, the patient can elaborate on their chief complaint. So he will provide more information about the chief complaint which the patient mentioned in the sorry in the chief complaint. So HPI contains more narrative description of chief complaint. An acronym often used to organize the HPI is termed old cards. So onset, when did the chief complaint begin? So these are the things physician needs to do or document in the patient's medical record in order to code properly. So old cards, onset, when did the chief complaint begin? So at what time chief complaint is begin? Location, where is the chief complaint located? Duration, how long has the chief complaint been going on for? So characterization, how does the patient describe the CC? Usually we will call it as severity. Alleviating and aggravating factors. What makes the chief complaint better or worse? Next one, radiation. Does the chief complaint move or stay in one location? Temporal factor. Is the chief complaint worse at a certain time of the day? Severity. Using a scale of 1 to 10, 1 being the least, 10 being the worst. How does the patient rate the chief complaint? So basically, HPA contains all these constituents, which is onset, location, duration, characterization, elevating and aggravating factors, radiation of the chief complaint, temporal factor which increase the chief complaint, and severity of the chief complaint, which is on 1 to 10 scale. So next one in the subjective is history. Usually we will call it as PFSH. So past medical history, surgical history, family history, social history. So medical history pertinent current or past medical condition. Here we need to find patient's current or past medical conditions in order to treat the patient properly. Surgical history. Here it will include the year of the surgery and surgeon if possible. So family history contains pertinent to family history. Avoid documenting the medical history of every person in the family history. So basically family history contains blood relations like father, mother, and siblings. Social history. An acronym that may use it for here is HEDAS, which stands for Home and Environment, Education, Employment, Eating Activities, Drug, Sexuality, and Suicide or Depression. So, based on social history also, physician can determine or decide the patient diagnosis. Next subjective contains review of systems. So, this is a system-based list of questions that help uncover symptoms not otherwise mentioned by the patient. So general weight loss, decreased appetite. So these all are observed by the physician, not patient. General weight loss, decreased appetite, gastrointestinal, abdominal pain, hematochezia, musculoskeletal, toe pain, decreased right shoulder, range of motion. So physician will find this review of systems. Next one is current medications or allergies. So current medications and allergies may be listed under the subjective or objective sections. However, it is important that with any medication documented to include the medication name, dose, route, and how often. So in order to code medication properly, for example, if you take insulin, you need to know what is the route of the insulin administration. Is it oral? Is it subcutaneous? Is it is muscle? We have an example here. Morphine 600 milligram orally every 4 to 6 hours for 5 days. So in order to code properly, physician must mention the documentation in this format. So next one is what is objective. So objective section documents the objective data from the patient's encounter. This includes vital signs, physical examination findings, laboratory data, imaging results, other diagnostic data, recognition and review of documentation of other clinicians. So objective means these are the values we will get or documents we will get here. So objective basically contains vital signs, physical exam findings, laboratory data, imaging results, and if it is fine, other diagnostic data. So in order to code properly, we need to know the difference between symptom and sign. So symptoms are the patient's subjective description and should be documented under the subjective heading. so which is usually chief complaint, while a sign is an objective finding related to the associated symptom reported by the patient. So an example of this is a patient stating he has stomach pain, which is a symptom documented under the subject of heading, versus abdominal tenderness to palpation, an objective sign documented under the objective heading. So basically, symptom is the condition mentioned by the patient and sign which is diagnosed by the physician. So in SOAP format, third one is A, which is assessment. So what is assessment? This section documents synthesis of subjective and objectives evidence to arrive at a diagnosis. So assessment contains combination of subjective and objective terms. This is the assessment of the patient status through analysis of the problem, possible interaction of the problems, and changes in the status of the problems. In subjective or in assessment, following elements are included. First one is problem. List the problem list in order to importance. A problem is often known as a diagnosis. So assessment must and should contain a diagnosis. So differential diagnosis. This is a list of differential possible diagnosis. So never we can't quote from the differential diagnosis, though as differential diagnosis are possible diagnosis. These are not confirmed diagnosis by the physician. Next is plan. So what is plan? So plan section details the need for additional testing and consultation with other clinician to address the patient's illness. So after completing subjective, objective and assessment, physician will decide whether does patient need any additional testing or patient does need any consultation with other providers. So it also addresses any additional steps being taken to treat the patient. This section helps future physicians understand what needs to be done for each problem. So here state which testing is needed and the rationale for choosing each test to resolve diagnostic ambiguities. Ideally, what the next step would be if positive or negative. So plan section contains diagnosis as well as the recommended testing. So in order to find for the future physicians. So plan section usually contains therapy needed. So what are the medications needed in order to treat the patient's current condition? So whether patient need any specialist referral or and also plan includes patient's education, counseling, how to reduce the fear about the condition and how to take the medications. So a comprehensive SOAP note has to take into account all subjective and objective information and accurately assess it to create the patient specific assessment and plan. So if the documentation uses SOAP format as a coder, we no need to worry about any information which we needed to code properly using CPT and ICD 10 CM codes. Happy coding guys. Thanks for watching Fast Coder 21. Please like, subscribe, comment and learn.